Good afternoon and welcome to this meeting today, May 14th, to discuss grant allocations from the Economic and Community Development Committee. I would like to start the meeting by acknowledging all of the agencies that are here present today. As you all know, the organizations that are being looked at today are the organizations that topped the top 16 scores from the process, 13 scores from the process. The first meeting that we had in this round was the meeting in which we discussed the contracted services that were being provided to the city of Topeka. Before we go any further, I really feel the strong encouragement in reminding people how thankful we are and how lucky we are that our city at this time, I think, is the only municipality that awards such grants to their communities. And although we sincerely appreciate every single thing that every organization does, as you all know, we don't always have the funds to give every single person all of the money that we want. I wish I would strike the lotto and be able to just say, here's everything that we have to give. But I am excited on one side to be able to look at all of you and say, we have established as a committee processes that all of you were a part of establishing. You had a chance to give input. We're excited that we have a process right now that is going to help us be a stronger organization moving forward. And in return, we hope that this process is also going to be a tool to help these organizations, all of you, to look at what you're doing as an organization to help you raise the bar maybe as you're applying for these funds. So with that being said, the meeting has been called to order, and I would entertain a motion for approval of the minutes of the last meeting.
So moved.
Do I have a second?
No, I would like a chance to review them. I do not think they reflect, we had a lot of conversation at the last meeting about just how the structure would work and how the points would work, and I know that you announced consensus on using option one, but I think the record would show that I had questions about that. I didn't object, however, when you said consensus, because we were talking about doing some tentative scoring and going through and seeing how that system worked. And I'm just not certain, as simple as these minutes are, that I think I would like to have some more in them, and I haven't had time to prepare those comments.
So would you like to defer the
Yes.
approval of the minutes?
If we could.
Okay, well,
Thank you.
Councilman Schmidt?
I will second that.
All right, all in favor?
Aye.
All opposed, same sign? Okay. Amber, if you could get in touch with Councilwoman Hiller. Next item on the agenda is discussion of funding allocations. Just to give everybody an overview, for those of you that were not able to witness what happened on Monday, the way that the process is tentatively going is we have had a chance to evaluate, staff has had a chance with a committee of 5 people to do an evaluation of all of the applications that were received by the city of Topeka. Now, all of those applications, once they were received, they were vetted by a committee of 5, and the scoring was a top score of 100 and, of course, a lower score of 0. I can tell you that the grants, I provided a spreadsheet last time showing that our highest score in a grant was a 98, and our lowest scoring grant was a 57? 57. So we had no zeros, but we did have some grants that did score in the range of the 50s. What's going to happen today is very similar to what happened in the first meeting. We are going to take a look at the grants from highest scoring application. We're going to have staff is going to provide a brief summary on how the score was achieved. The body is going to be able to ask questions pertaining why the scores were the way they were. And after that, we have come up with different evaluations on tentative allocations. Now, we do not vote immediately on those allocations because what we're doing is that we're trying to generate consensus of where we think we are. Right now, I can tell you that we have $407,000 to be allocated. Out of those $407,000 to be allocated, 25% of those, so approximately $107,000, are going to be emergency aid, and another 307, I think, or 300 and something, are going to be allocated to preventive and counseling services. So if I am correct, what we're going to do is initially, we're going to only tackle initially the counseling and preventative services first. And then we're going to address the grants that achieve that first level tier within emergency services. And again, it's gonna be a very similar process than last time. I asked for your indulgence in giving us an opportunity. As you all know, this is a new process. The other thing that I will say is that we are already receiving feedback of things that can be done better with the process next year. We know for a fact that we have received several comments with regards to the budget. We are going to ensure that next year in the budget, there is a clearer line that will ensure your ability to say where the program funding is going to. That was one of the questions that kept on coming back. It's like, okay, so from these funds, where is that money going to be allocated towards? So that's gonna be something that's gonna come up. And then the other thing that we have heard is that there is an interest in understanding better the metrics on how the grants are going to be evaluated from now on. Now, I do want to remind everybody that as we came up with this process, there may be things that are not congruent with last year that may be affecting you this year in your grant evaluation. And that is why we have the opportunity to address these things via questions. Staff is here to answer any questions. And finally, I will wrap up by saying that one of the things that we agreed on from the beginning was that once the grants were public and open and everybody had had a chance to listen to what the feedback was, then you're able to go ahead and contact staff, just to give everybody a chance to go through the process. So at this point in time, I will defer to my colleagues and ask if they have any questions or any comments before we begin.
One quick question, thank you.
Yes, ma'am.
I wanted to prepare by reading the application, so I emailed council staff, who sent me a list of what I thought we were doing was the top she sent me a list and said that top 13 scorers were who we were looking at today, and those are
Correct.
the ones I read.
Mhm.
Okay, I thought you said that we were doing just the prevention and counseling, and I wasn't
No,
sure that was the divider.
Prevention and counseling, the top 13.
Okay. Okay. Thank you. Just want to make sure I read the right ones.
No worries, ma'am.
All right.
Any other questions or any comments from the committee?
Nope.
If there's none, the first question that we would like to entertain is, again, just for conversation's sake, at this point in time, seeing how the process went at first, do we want to go with agency names or do we just want to go with agency numbers? Agency scored 1, 2, 3, 4.
I think the names just make it clearer. I am more comfortable, by the way, with not having the scores in advance and just reading the
Okay.
applications.
All right, well, Corrie, if you could pass on to us the sheets
With the names.
with the names?
I actually prefer without the names, but
I would too. So that makes 2 of us then.
I think you could start without the names and then maybe if you could go to just an idea.
If we would like to take this to a vote then, would you like to make a motion?
well, I think if you would like the names, if you're willing to not divulge them to us while we're going through it, I think that would be fine. If you want to look at the names, I would rather not, you know what I'm saying?
Mm-hmm.
Well, it'll be obvious. I mean, one of the reasons to go through these to me is that there are elements that you might have a question about. Would probably reveal who the agency was, so.
Well, and
We can ask staff about the specific agency to go and elaborate on where the scores have discrepancies without having to go into the detail of the specific agency though. And that will make it more,
I'll do my best. I feel like I'm running blind, but if that's what you want to do.
That's how I would prefer to go.
I would echo that.
Okay. Here's the, pass that down. So I went ahead and, if I may.
Yes, Corrie, it's all you now.
Okay, I went ahead and divided this into tier 1 and tier 2. Of course, today we're talking about tier 1, but I wanted to see the implications that would have on tier 2 with the different options that we chose. So the first option, similar to our last meeting, was taking the 305,250, 75% going to tier 1, 25% going to the second tier. The second sheet, again, was the 50-50 break, which you may or may not consider. And then the third option would be to fund people at the level they requested until we run out of funds, which would obviously impact tier 2 more so than tier 1. So those are kind of the 3 similar options that we had in the contracted service meeting. And this is for everybody else, this is the breakout of a number of goals, the number that they obtained last year, the score from the review committee, and then a percentage based off of that score, and then the ranking, you'll see in the column there.
So at this point in time, let me see if I could summarize this correctly so that we could kind of wrap our minds around this. If we were to approach tier 1 by a 75% allocation and a 25% allocation for tier 2, everybody would still get funded,
That's correct.
okay? However, because the grants in tier 1 had a higher score, therefore there's a higher possibility of receiving more funds for them.
Right, with the first option here with the 75-25 split, we would still base their amount that they requested based off of their percentage rating. So for example, agency 1 there scored a 98%. 98% of the 19,858 is 19,461. And then the difference, of course, would be calculated in on the percentage of money that they requested, which would then take them to 17,683.
Question as we look at that?
Yes, ma'am.
Part of our metric that we agreed, this is making more sense to me, it's just, anyway, part of the metric we agreed was that we would make no grants at less than $10,000. And so if that's the case, then most of these, once you get below about 8, they start to mathematically drop below our minimum threshold for grants with that system.
With the tier 1 system you're referring to, right?
Yeah, I mean, I'm looking
Or
at
the
it,
option 1 system?
option 1 system.
Even option 2, actually, because when you look at the percentage scored compared to when you go to agencies 7 through 12, allocation options, and it's just this group, even though they were higher scoring, they only score, there's an award amount of 5.
I would very much so like to start with option 1. Option 2, I don't know if you paid attention to this, but our highest scoring agency would receive $7,000 less than what they requested, and our 13th highest agency would receive $7,000 more than what they requested, which doesn't seem right to me. So I think if we're going to pick an option to start with, option 1 is much like we did yesterday, or whatever day that was.
I will second that.
It's been a long week.
That still does not solve the situation of the policy that we established with the grants. Now, my question is, did the policy that we set forward state that we were not going to award, or that we were not gonna take applications for less than 10,000?
Actually, that was your idea, and as I recall, the concept was that it was not cost-effective to make a
Correct.
grant award at that amount based on the work that the city as well as the agency would have to do. That's what I recall being behind that decision.
At this point in time, because it's a first time of us trying to make sense out of these grants, I am not beneath saying that I am happy to amend my, my initial recommendation. Very happy to go ahead and rescind to that if it would help us establish the allocations today. And this is something that maybe we could look forward to a little bit deeper later on.
I'm still processing from the whole thing, and I really appreciate all of the efforts to figure out a good system on reflection after last week, one of the things that we talked about a little bit, but the concept of asking, separating the funding from the scoring, in that if somebody needed more money, we didn't specifically ask them why, for instance, or cut that out separately. It so impacts everybody else down the line, depending on where that agency would fall. It did seem like somehow considering that.
Corey, do we have available the chart with 2014 allocations?
Oh, yes, we do.
That would be very helpful in this process.
It did not make multiple copies of it, however.
I've got one.
Do you have
And we
one?
do.
Okay.
It's long, so
This is
this is the document.
The last sheet is really the one that has
Yeah,
all that
2014.
information.
Allocation and the 2015 requests are on the third sheet. This goes all the way back to 2011 if somebody wants to see it.
I have an extra one to look.
Is that-
If
is
you
this
want
an
to look
extra?
at it, yeah, it's just an extra.
I mean, in part, we were trying to get away from just going back to the year before and making adjustments, so I get that. So we're just struggling with what would be most successful. I know that.
And again, the challenge, like you're saying, we're trying to establish a process. And my only fear is that we have already told the organizations how they were going to be evaluated. And us going ahead and going back is us going back on our word. And I understand your sentiment, but I am a person that if I say that I'm gonna do something, I'm gonna do it. And we have been talking to the organizations about how difficult the process was gonna be because how committed we all are to seeing them successful. And we talked about how we wanted to make sure that before the grant application was in, there was enough time. Actually, one of the reasons that we had the first meeting was because we wanted to ensure that the agencies were gonna have enough time to communicate with staff through the granting process, so that when their applications came in, they were complete with all of the information that they needed to provide from to the city, so that there would be no questions absolutely when the grants were delivered and then scored. So us going back and trying to evaluate what happened last year, it's a deviation from what we had agreed as a body that we were gonna do. And that is my concern.
You mean the funding?
The evaluation of the grants and how we're gonna fund them this year. So just like you're saying, well, I wanna go back to last year and see why they requested more.
Well, we know that off the application, you know, so we don't need to check. They tell us what they got if they were funded by us last year, so it's right on there. I'm only looking at making sure we're fair in terms of people's funding and the quality of their application. And then if there are other issues, we've got a couple today where we were advised and educated about some bigger issues and trends that were happening in that area. Senior transportation, senior centers being one of them. We've also got to change, I mean, some of the questions that I've got today have to do with how now having health insurance available to everyone in America affects some of the health providers. That's not built into a score, but that's an issue in terms of funding and options and what they're doing with their programming, so.
But that's not what we told the applicants that we were going to evaluate at the time that they submitted their grant. And that's where I'm going back to the point that it would be unfair for me to go ahead and say as a grantee, oh, by the way, I would like for you to go ahead and give me a grant based on these standards, and after I receive the grant, me turn to you and say, by the way, I just found out that there's other funding for this, and I want to go ahead and change the rules of the game. And that's my concern, that we have already established the parameters on how the grants were going to be evaluated. We have them in front of us with the allocations. I think that your concern, which is extremely valid, is a concern that is addressed at a policy level going forward.
Possibly. I mean, that we're feeling our way through the year this first time. We certainly wanted the scoring so that we had a measure of performance to consider.
Correct.
I don't think we told anybody that was the only thing we would consider. We certainly wanted to improve the measurements of performance.
And that is why we agreed on the application that was set forth. I mean,
Exactly, exactly.
Mr. Schmidt?
Yeah, I, part of the reason we redid this process is that we want to create something that is more objective than subjective. And that's why I like the way that we're going through these. I like the way that we're getting a fresh look at these scores and not introducing our biases into them. That's also why I think, the original idea of no allocation over $10,000 had merit, and my proposal to fix that problem would be to remove the
$10,000 cap?
to remove the funding from the bottom agencies until we get everybody to $10,000 or above, and that's the way the process would work. I would not advocate doing that this time since it's the first time through, so I'm okay with having allocations under $10,000 for the first time too, since everybody, including staff and the agencies, are getting used to this process. But I think for this process to stand the test of time and to stand whoever is on this committee next year or 5 years from now, it needs to be to the point where we're taking the ratings that staff is delivering to us. We're looking at these, and our discretion is rare, or our influence is rare, in that we will go in and correct things that may be egregious or circumstances change dramatically. But for the most part, I think this needs to be a rote, mechanical, and objective process.
Yes, Ms. Hiller?
Just for discussion, I disagree. I think the reason that we took this over and that we were retooling the process was to make sure that both on performance but other factors, that we were putting the taxpayer dollars in the places where they were the very most valuable and needed in our community. And those circumstances change over time. And one of the things that we built into our process was the opportunity to ask experts to join us. And my understanding of why that was in there was so that council committees change, and some council members are very familiar with certain agencies or the whole network or the whole milieu of social services, and others are not. Either way, if it would help the committee to have experts who are in the field every day that could help give feedback about those trends and changes in the community, we could do that. This committee opted not to use any expert advisors this year, which was fine, but my understanding is that's what that was for. We got testimony last year, we all went through that, of trends and changes that weren't reflected in the applications. And one of the reasons we did this process was to not do just formula, just automatically give cuts or ads and so on. And I know we've built many more pieces into it. My view was that we were going to have that overall view as well.
Ms. Hiller, just to reply back to your comment, with all due respect, I think that, and please correct me if I'm wrong, the understanding that at least I had individually was that the intent was of creating a simple, transparent, replicable model that was going to be set forth so that staff, who is the group that looks at all of the grants, was able to, based on the policy that we set forth, which was the application, able to evaluate and score the organizations based on their outcome performances and metrics that we felt that were strong and that would be in sync with the city's values and goals.
And we're trying this for the first time, and if in fact where this goes is that we create some other questions and metrics for the staff to score and do leave it with the experience of the first year at a little bit higher level for the staff. I understand that.
Mr. Schmidt?
I don't think what you're saying is different from what I was saying in a lot of ways, other than maybe implementation. Yes, we set the priorities where we feel the taxpayer money should go. That's part of the policy, but we do that in establishing the scoring criteria, which we turn over to staff to do. What I want to avoid is this committee scoring each of these individually. If there are exceptions and things that need to be pointed out, then we can consider those and go forth from there. But the burden of scoring these is on staff and the committee that got together and scored them. And I think they did an excellent job. They're human. They're like everybody else. We may make some minor corrections, but I don't want to get into the habit of having elected officials coming in and individually scoring each of these grants. I want us to come in and review the process that staff has gone through, and I think that's important. Now, we can set the priorities.
Yep.
And we can set the scoring system.
Absolutely.
But as far as individual applications, I would be very hesitant to move into those areas and judge them that way.
Thank you. I'm ready to proceed.
Thank you. Just a small side note, a request from media, just to let everybody that's watching from home know that the meeting that you're expecting to see at 1 o'clock of City Council will not be running because this meeting is running live. So therefore, hang tight. You may have fun watching this meeting, and after this meeting, you will see the the council meeting. And after the council meeting tonight, we will be also showing JADO, which is a Joint Economic Development Organization. So just so that you know that you will not see your council meeting being repeated right now.
But it is available on webcast.
Online, yes, that is correct. So that being
I
said,
really want to watch it right now.
that being said, Corrie, if you would like to start with Agency 1.
Sure, what is it that you'd like me to start? Do you want me to list the names at this point?
No, I wouldn't like the names.
Okay.
I think that just going over the chart and
Oh,
exactly.
Gotcha. The scoring from this sheet, the agency one, they only missed 2 points, which was on organization leadership. Can you pull this one? Yeah. If I may.
Yes, ma'am.
I think maybe at this point, it might be easier to go ahead, if you've already established that you would like to go to option one, that maybe I go ahead and hand out the sheets, where I do have the score sheets of everybody with their names on it, of course. If you would like to hand it out at this point, I think, then Ms. Hiller, of course, can ask, or everybody, but Ms. Hiller in particular, can ask questions based off the individual applications in tier one.
I believe in consensus. Let's go for it.
Is that okay? Okay. So this is this pile. And then here's the scores on their application process.
Wait a minute. Okay. So this is the same.
This is just the.
This is just the one with names, and this is the one with that.
Yes, it is exactly the same.
Okay, thank you.
Okay. So, as you can see, I highlighted on the tier one application sheet, I highlighted the ones that they scored less than what they could have scored. So you can identify where the weakness was in their application, their particular application. So
And in the organizational leadership, could you elaborate which was the area that they missed the points on?
Sure, on the first one there, the three areas were, 70% one gender. I didn't bring that sheet with me, I apologize if I may
It's right
look
there
at
if
it.
you-
Okay, thank you.
Want to read it?
15% made up of racial ethnic minorities, that was 2 points. 70%, less than 70% one gender was 2 points. And then, the board shows a healthy mix of individuals, from various aspects was 1 point. So on the, are you referring to particularly the first agency,
Mm-hmm.
Boys and Girls Club? Okay. Boys and Girls Club is right here. So they had the gender mix-up was the one they lost their 2 points in. They had 80% one gender.
Any other questions from the committee? No? Mr. Schmidt?
I would say congratulations for being the highest scoring
Mm-hmm.
application.
Okay, so
But I
that,
don't think anybody knows who it is, do they?
at this point in time, if we're gonna kind of follow the same system that we did last time, they had an original request of 19,858. Is there, looking at our initial chart, we kind of said that we were gonna go on tier one. Is there consensus on the 17,683?
And this is, and I'm just getting familiar with this, so forgive me. This is because we're not gonna allocate, we're reserving money for the lower tiers.
Correct.
25%.
There's a 25% at this point for the lower tier. There's a 75% because these were the highest scoring grants that is being considered for this group.
You know what, if I can, and this is backing up to process. One of the things we talked about coming into today was whether we would set a threshold by which we needed to see numbers before we knew how the scores would fall. But if we, for instance, set a threshold of 80 points as a threshold score, that would resolve some of the issues that we've seen. I don't know who the agencies are yet, so.
I don't understand your 80 points
Well,
threshold.
in the calculations for option one, you know, cutting a high-scoring agency, if we ended up making grants only for agencies that scored more than 80 points, it would fill up the numbers for. the
So then it
others.
would mean that the organizations that scored lesser than 80 would not get any allocation at all.
That's how that would work. yes.
And that would be pretty much.
I know you had discussed that along the way.
Option
And that
three.
is pretty much the third, if
That's
you
what
look
the
at the
third
third
option
option,
is, okay.
that's the third option. That's why all those options were presented.
Gotcha, okay.
So it would mean that the grants, the organizations in tier two, more than likely, there's gonna be several of them,
Mm-hmm.
8 that would not receive any funding.
Mixed feelings. I mean, part of what we wanted to do with this process was to adequately fund the things that we were gonna fund.
Correct,
The quality services and adequately fund them, so.
correct.
I agree with that also. I have a heavy heart doing that on the first time through the process because everybody on both ends is learning how to do this.
Mm-hmm.
Yeah,
True.
which was my same argument for the $10,000 allocation. Of course, that would take care of the $10,000 issue too.
Mhm.
Yep,
All but except for one, but yes.
well, no, it would push them up. It probably wouldn't.
All except for one. Very close.
Oh,
Get us within $600 of, yeah. I don't know if I'm comfortable yet with the 80% rule. I'm also not comfortable with our top scoring application receiving $1,800 less than they requested.
And this was the hard part, just for
Mhm.
conversation's sake, that I said that we were going to have to face at this point in time, which was ensuring that the same thing that I'm advocating for is ensuring that the process works. Then we're making sure that the process works, and we're really raising the bar for organizations to produce excellent grants. And to be honest, when I see, and I'm just looking at agency numbers, not agency names, so when I see grants with a 57% in them, it really just makes you wonder, are we just giving the funds, because we're giving the funds, rather than going ahead and pretty much this is, in all my years of working with grants, this is what HUD does.
Others too.
And others too. I mean, it's just a threshold of higher scoring grants. And I think that it helps not to look at the names at this point in time.
Absolutely, good idea.
Well, I think we're going to, I would initially like to start with option 1 for this year, because it is a new process and this is the first time everybody's been through it.
Would we like to take this
I
to a
can
vote?
be overruled if we want to go with option 3, but
We could go for a vote, and that way we could just move forward. And if somebody wants to make a motion,
You know, because we've not been through it, we don't know, as one of the things that didn't make the minutes last time,
Let's-
we're looking at how the process goes and what it was that people struggled with. I don't know what they are yet. I don't know how that worked. Well, but if we want to do it blind, you know, I don't know.
it goes back
If
to.
I may interject. On the tier 1, the application scoring sheet, you can kind of see some trends in particular duplication. Those that did miss points on that simply didn't answer the question on several of them. Organizational leadership was frequently missed, as you can see. Past grant administration, I think those numbers are going to increase because of this new process that we're going through, where it's going to be more critical for people to get their reports in on time and numbers correct. And then government partnerships, private partnerships was government in particular, just simply, again, people not stating their partnership with city or county government, so they miss points on that. I think that will very much change next year too with this new process. So I am in concurrence with Mr. Schmidt that this is a process for this year, but next year it will look and feel a lot different and more aligned with what you're trying to do.
Well, one element that we struggled with last time is if somebody's outcomes were weak, how could
Right.
they get a good score? Though that one is a combination of goals
Right.
and outcomes, and we might well split that
Mhm.
next year just for the clarity. I mean, you've got a couple on here where their
That's
outcomes
definitely on
were-
our list of
were
things
weak.
to get fixed for this year. The 14 money is already out there, so Rochelle and I had a discussion today about the third quarter implementing these new outcome focus. So next year, we don't have the same problem with some people having outputs, some people having outcomes, and how do we measure the two differently. So it is something that we'll address for the remainder of 2014.
As part of this process is a discussion amongst us about the outcomes and the goals and
Sure.
so on, so that
Mhm.
we're all learning from one another as well.
So what is the pleasure of the committee? Does the committee want to entertain the goal of the 80%? Does the committee want to go down to the 70% level?
I have a question for staff real quick. On the On the, option one, the reduction from requested amount, the basis of that is just that there was 278,876 requested, and we allocated 229,000? And you
That's-
just took the percentage and applied that across the board?
That's correct. So like on agency one, for example, they requested 7.7% of the total budget, and 7.7 of that 23,021 would equal the
Okay, I see what you're saying.
1,778. So we would subtract that from the amount, and that is in order to get us to the 228,938 at the bottom there.
Okay.
But the option, oh, your option two was just to only put 50% of the
It was a
money.
50/50.
It was just an option I was told to put together.
Okay. Just so that we could see different numbers and how
Okay.
they would, the numbers
Never
would be
mind.
affected.
Not my favorite.
Okay,
Neither mine.
no, it didn't fit.
But it was something that was mentioned, I think, in one of the meetings, so I
was.
just wanted to honor
Okay.
that. And I think this is wonderful discussion, because once we determine how we're going to proceed, it's going to make this go a lot quicker process.
And I think we do have to think about not just this year, but as the policymakers to set this, of what this would look like next year and a year after that. Whether we do something straight line this year or do something a little bit different, we're trying to set a footprint for the future.
I mean, the only concern that I do have is, it is understandable to have a score in the 80s when you have a brand-new system, but when you look at scores of 60% and 57%, I don't think our community would be very happy with us
Right.
if we have hardcore fact and we're giving allocations. May I propose a suggestion that's not even here? If we go with any grant that is over 80% being funded, and then the grants that are, because we only have a few in the 70s, then pull out the rest of the funds that will be remaining for that and try to distribute it. No, actually, no, because there's all
Well,
the
you're still
money.
wanting to use your tier one style,
No, I was actually
point.
going with option 3, your suggestion of
okay.
only funding grants that meet the 80% score,
But dropping it to 70?
but then dropping it to 70, so that means that there would have to be,
Dropping it to 70 and taking the roughly $15,000 and moving that into the tier 1 pot? Is that what you're saying?
because I'm thinking that the concern that we have is that the grants are scored extremely high. We
Mhm.
want to ensure that they get funded at 100% or, or close. But then that leaves us with, how are we gonna allocate the funds of the grants that are on the scores of 80, so that there's some funding available for the grants that scored in the 70s?
There won't be any funding if you do it that way. Is this,
Yeah, because there would be 15% out of all these funds available to allocate here.
except this is, you're saying, are you asking to apply this at 85% of requested?
Correct,
Of what they requested, not of this amount?
exactly, of requested.
Okay, we have 82% of the amount requested available. So if you give 100% to the top 90% and 85% here, we're pulling money from down here already. Before we get to that point, a considerable amount of money from here. You wouldn't fund either of those probably.
No, because here's the allocations, there's this much money left, so you'd be only pulling 15% out of this.
You're saying 15% of this number?
Mm-hmm.
Okay, that's right, because these are not option 3 numbers.
And that would
Not
release
option 1
funds
numbers. Okay.
to
I see what
fund
you're
here
saying.
at a smaller allocation. You see what I'm saying? We're looking at the grants, for everybody that's looking at home, the grants that are scoring 90 and above, looking at if we allocate them at 100%, what it would look like, and then the grants that are in the range of the 80%, if they would receive 85% of the amount that they requested, it would leave a little bit of money to be allocated for the grants that scored in the 70s. And then instead of several organizations being docked funding because they did not meet criteria, I think it's only 2 organizations that are scoring below the 70 mark.
There's 3.
There's 2, there's a 60 and a 57.
And there's a 61 above. It looks like a new one.
No, but that one was calculated, if you look at the
Okay.
percent
Yeah.
rating,
There's
only 2.
I wasn't sure how you were.
I'm okay with using that as a basis, and we'll go through the applications, then we'll punch in the numbers and see what comes out.
it gives us here a total of 46,862 to allocate among these organizations that scored in the 70s, if we do it this way.
May I offer another suggestion?
Yes, ma'am.
On the, if you look at tier 1, the allocation by rating, which would make them much closer to the percentage that they were requesting, it equals 251 for a difference of 23,021. We could take that 23,021
And allocate
and
at the
deduct it
bottom.
from the tier 2.
That's what I was,
Mhm.
that's, that was when I looked at your ratio that you wanted to use,
Mm-hmm.
that blend them. Mhm.
Which means we would allocate,
19 for the first one.
It would still keep
Here it
us
is.
basing their score, basing it off of their
Of their
application
score.
score.
Mhm.
What was initially suggested?
I gotcha.
Would we like to proceed with that tentatively? Since it shows that all the organizations then would receive some sort of allocation based on their
So,
percentage
so
score?
you're saying do the allocation based on,
Percent by
okay,
rating.
okay.
So basically, it would eliminate that agency allocation of shortage line item, and it would just take that 23,021 and we deduct it from the bottom tier 2 folks.
Just pull up the bottom. Yeah, because this was an arbitrary line to put in, the 251
Yeah, the
So just
percentage
cut
of
it
funding,
loose.
yeah.
to the 278.
Mm-hmm.
Mm,
Is there
that's
consensus to proceed with that allocation to start with?
classic committee decision.
I'm okay with that.
I think it pulls it up better.
Perfect, all right. So, Ms. Wright,
Do you want me to just go line by line?
line by line.
Okay, so Boys and Girls Club would be funded at 19,461. Positive Connections, 36,978. Resource Center, 23,250. Breakthrough House, the Clubhouse, 26,956.
What?
No, 19,
I don't think
780.
so.
Oh, pardon me, I'm sorry. I can't read that line. It's too small. Community Action Project Detention, 26,956. Breakthrough House Clubhouse, 19,780. TDC Full Daycare, 16,835. Project Health Access, 52,800. Big Brothers Big Sisters, $9,499. TDC Parent Child Learning Center, $8,600. Girls on the Run, $10,080. Topeka Youth Project Jobs for Young Adults, $15,120. And LULAC, $12,600.
How does the committee feel about this? Are there questions that would like to be asked of the committee to staff right now with regards to the percent funding?
Let me do a little math here first. So that would take, that,
251.
that's 251
$958, yes.
out of the
307.
307. and what was the
305.
total? 305.
250.
Okay. So we subtract, that would leave us with 305, 250 minus 251, 958.
Oh.
That's gonna leave us with $53,292 to allocate through to the rest of the tier 2 grants, correct?
No. The prevention and counseling services is 305,250, but if we're using the 75% tier, that next line over is the 228,938.
But I think that at this point in time, because the committee did not want to look at the percentage, they wanted to ensure that the higher scoring organizations
I see.
got the maximum amount of dollars.
Okay.
What is being looked at is how much would be remaining then to allocate
I
for
see.
tier 3.
Okay.
Am I correct? Committee?
Okay, you've got 251 for tier, what you're calling tier 1. So the tier 3, where is the break that you're talking about? At 75?
The tier 1 is 75%, tier 2 is 25%.
No, but it's scores. We're breaking into a tier 3 because of scores.
What we're doing is we're abandoning the 75-25.
Thank you.
Right.
Well,
That's gone.
Gotcha.
What we're doing is we're taking the top ranking, the tier 1 grants, and we're allocating them based on the percentage rating,
Okay.
which gives us $251,958 allocation for those, which exceeds the 75% threshold, which was $228,938.
Okay.
That leaves us with $54,925 to allocate to the tier 2 grants, which I believe we're doing tomorrow.
53,292.
50. You sure about that? Because I
Look,
got
it's
her.
right there in front of
Oh
you.
yeah, that's what I have to. You're right. 53,292. I was right. 53,292 to allocate to the
Correct.
others. How we do that, I guess, is the next meeting. But
Mm-hmm.
Okay. Help me with this. So the emergency aid, I just thought we were putting everybody in and ranking everybody and then looking to see whether the 75-25 split between prevention and counseling and emergency aid emerged naturally and then adjusting it if it didn't.
No, emergency aid is in its own separate category with 25% of that $400,000.
Which is,
But we'd said it could give or take 5%, and I thought that's because we were gonna just look at them all together and see how they fell out.
I think that's what we're doing here. Is
Okay.
we're creating the preliminary allocation. We'll look at it, and if it turns out, after we go through the next meeting, and it turns out that we gave somebody the shaft in one category and not in the
Forget
other,
that.
we shortchanged somebody in one category way more than we could have in the other. Well, we can adjust that 5% range.
Correct.
Sorry.
I did bring this sheet on the emergency side if you wanted to address the tier 1 on the emergency side today. I didn't know if we were doing all tier 1 or not, but it's here if you need it.
I'm happy with that allocation. I would like to proceed and go through, and just hear the scoring
Ms.
of the
Hiller?
grants. Go
Well-
through each individual.
Okay.
and Get a summary of why
Okay.
they're in red.
And
Do you want
and
me
we
to
can
go
ask questions then if, we
Mhm.
did Big Brothers, or Boys and Girls Clubs, so, okay.
Mhm.
Do you want me to go through each line then? Each line, or just the ones that they missed points on? Either way.
I'm fine with just the ones that they miss points on.
Okay. Positive connections, missed points on organization leadership and past grant administration. No, I just wanna see.
Yeah, but I can never find these because they always put them on the bottom. Are they alphabetical? No, they're not.
And the points that they missed on org leadership was they, gender, more than 70% one gender,
Right here.
and the 15% ethnic minorities.
We need smaller books.
It's a two-hand process.
Ms. Hiller, do you have any questions of this grant?
I don't. It did prompt me. I had a question going in, and that was how the new Affordable Care Act affected it. And it did appear that they were right on it and training staff to deal with that and getting people signed up,
Okay,
which I thought was appropriate.
wonderful.
So,
Mr. Schmidt, do you have any comments or questions with regards to this application?
I do not.
Okay,
one other,
Ms.
just an
Hiller?
observation for our process, and that's that I wondered why they had a $26,000 increase, which is more than anybody else asked for. But it appeared because the county cut them, so it's something for us to keep in mind as we look at process and decisions.
okay. Thank you for your comments. Ms. Wright?
Okay. The Shawnee County Family Resource Center, lost 3 points on scope of project. They lost 2 points on org leadership, 4 points on past grant administration, and 2 points on government partnerships. Nope, I'm sorry. Take that back. I need a ruler, is what I need. Apparently, or
Maybe we can
glasses,
give
one
you
or
an
the other.
upside-down piece of paper.
Yeah, let's do that. Okay, scope of project, they lost 3 points. Org leadership, 2 points. And government partnerships, 2 points, for a total of 93.
You know, for those that are listening, by just listing their dings doesn't give their strengths. It's,
Does not, yes.
Does the committee have questions to Corrie with regards to the grant?
I hope that from here on out, she could go through just point by point. I know you can do it quickly, but particularly for people that are watching and listening, to talk about their strengths, not just where they lost points, I think is a better way to
Okay.
present it, if that's all right.
That is okay.
I had one question about that one, and that's whether the law enforcement officers were involved at the elementary school as well as the high school.
On the government partnership? Is that what you're
On the
referring to?
KCSL, they don't call themselves the Family Resource Center anymore, but the, whatever it's called here. Supporting school success program. They're working with
Yeah, I did.
Topeka High and then some elementary schools, and it was just a question on my part.
Yeah.
They talk about LEOs, which is law enforcement officers, I assume. They could answer it from the back.
Would you like to call?
Sure, if you can answer it.
I was gonna say, is that a question for the
Sure.
grantee?
I think we need to
You
give
can
you a
approach the
mic if you can
microphone.
get there.
Question is does law enforcement work with us in the elementary schools as well?
Yes.
Yes, they do.
Okay. Okay, thank you.
What was your question answered, Ms. Heather?
Yes.
Any other questions?
Nope.
Okay. Corrie,
Okay.
you can proceed.
The Breakthrough House Clubhouse, scored 15 out of 15 on city priorities, 10 out of 10 scope of projects, 5 out of 5 on their outcomes being clear, 10 out of 10 on duplication, 20 out of 20 on outcomes on prior grants, 10 out of 10 on effective management, 10 out of 10 on client input, 3 out of 5 on organizational leadership, 1 out of 5 on past grant administration, 3 out of 5 on government partnerships, 5 out of 5 on private partnerships, for a total of 92. I do want to add that on the applications on the government partnerships, if they did not indicate that they're collaborating with the city or the county, even though we knew that they were collaborating with the city or the county, they lost points. It was part of, we looked solely at the application.
And I mean, just as a comment to that, I think that that is something that is fair, because one of the things that, when I look at an application for employment, if you don't fill out the application, that's an automatic disqualifier. And I think that, again, this goes back to, once we have this process completed, it is important for the organizations to get in touch with the staff. I would highly recommend a workshop so that you're able to go line by line and try to get everybody in one room at once, rather than having 150 individual calls. But it's extremely important that we as a city make the effort of working with the organizations so that they know exactly what is expected of them for the next round.
Along those lines, one of the things with the Breakthrough Clubhouse that I noted was that we've been talking about outcomes and goals, and whether the outcomes are well stated and whether the goals and the outcomes measurements are well stated. Breakthrough Clubhouse made a shift in outcomes, and they defined it very clearly and carried it through, and that, I'm sure, made a difference in the scoring. But there were others that had made shifts or added new programs where it was a little mushier, let's just say. Thank you.
Mr. Schmidt?
What was the organizational leadership deduction? Could have been either race or gender.
It was ethnic minorities.
Okay. Thank you.
Okay, next.
Community action project attention, 15 out of 15 on city priorities, 10 out of 10 scope of project, 3 out of 5 on outcomes clear, 10 out of 10 on duplication, 20 out of 20 on outcomes on prior grants, 10 out of 10 on effective management, 10 out of 10 on client input, 5 out of 5 on org leadership, 1 out of 5 on past grant administration, 3 out of 5 on government partnerships, and 5 out of 5 on private partnerships, for a total of 92.
Ms. Hiller, do you have any questions?
The only observation was on, people were dealing with outputs, which are just how many people you serve and so on, versus outcomes, which is what difference did it make in their lives. There's an awful lot in this one. You scored well with staff, and I defer to that, but there was an awful lot in this one that was just, we gave out this many backpacks, but we don't know whether anybody ate the food or whether it made a difference in their lives. And to some extent, I know that's hard to do outcomes on, yet it needs to be a value for us to want to continue to fund it. So measuring somehow how that made a difference at home and long-term. The golf, for instance, sounds like it's a really successful program, and apparently there is a metric through that national affiliation that helps to measure how that's building self-esteem and physical activity and whatever. But it probably could be strengthened in my view.
Can you go over the past grant administration deduction?
Yes.
Or the reasoning behind
On prior city grants, they have received extensions to complete the grant, and so that's why they scored lost points there.
Okay. Thank you.
I've got that too, because they only showed like 13,000 the year before,
Yeah.
when their grant was 24, something like that.
Mr. Homlish, could you approach the microphone?
There's one right here.
That 13,177 is an audited amount. If you go to page 6, you'll see in the category that it says 2013 audited. Okay, that's all that was audited in our most recent audit was 13,177. Now, if we make that into a 12-month period, then the grant that we received last year, I believe, was for 24,195. But our fiscal people chose to use the figure under the 2013 audited as the number on the front page. And we had discussed that, and I think that could have created some confusion in the minds of the reviewers. But it's consistent with what shows up in the audit. Looks like you have a question. Because our audit does not run for a calendar year. Okay, does that help?
Well, if there were delayed vouchers, that all ties.
Yeah,
So-
this was, in particular, it was the HESG extensions that were required. That's-
Right, and that's a matter that I mean, we have never asked for an extension on the Youth and Social Services. We have asked for extensions on the homeless prevention. That's true.
And we consistently did that with all the agencies, so,
Okay.
yeah,
So if they-
same criteria we used on everybody.
So whether it was just this grant or any other contractual relationship with the city.
It was considered,
Okay,
Okay.
yeah.
thank you.
Thank you, Mr. Homlish.
Okay, thank you.
Mr. Schmidt?
Good.
Okay. TDC full daycare, 15 out of 15 on city priorities, 10 out of 10 on scope of project, 5 out of 5 on outcomes clear, 5 out of 10 on duplication, 20 out of 20 on outcomes on prior grants, 10 out of 10 on effective management, 10 out of 10 on client input, 3 out of 5 on org leadership, 5 out of 5 on past grant administration, 3 out of 5 on government partnerships, and 5 out of 5 on private partnerships for a total of 91.
Which one?
TDC.
Oh, full daycare,
Yeah.
okay, on the wrong one.
Can you explain the 5%?
The 5 on
Five
duplication.
on duplication.
We had a few that did not answer the question as far as the committee felt, and I believe this was one of them, that the question wasn't answered.
Okay. If I may, it just seems that a common thread is organizational leadership. Most of these organizations received significant, I mean, when you look at the line, my question is this due mostly, what was the one common denominator that came up within the organizations?
I would say it was 50-50 between gender and ethnic minorities.
Ethnic minorities
Yeah.
and gender. Okay.
Yeah.
And then could you elaborate? Okay, so this was the government partnerships again. People didn't answer that in organizational leadership. Are there any other questions from the committee with regards to this application?
just leaning on the outcomes if we could. On the program outcomes, I felt like of the 6 that they mentioned, that only 4 were actually outcomes. Talks about children having high-quality learning experiences, which is part of the program, that's an output. You measure that, which is the second one, children demonstrate age-appropriate developmental, self-help, and social skills, and there was measurement for that, so appreciated that. Learning needs identified and addressed is an action step. Parents being involved might be an outcome, particularly for these at-risk kids. So I was fine with that, but for everybody, identifying something that really is an outcome rather than an action step or an activity, and then evaluating that. So otherwise, they did well with scoring and putting measures in there. So.
Mr. Schmidt, any comments? Okay, let's proceed.
Okay. Big Brothers Big Sisters, 15 out of 15 on city priorities, 10 out of 10 on scope of project, 5 out of 5 on outcomes clear, 0 out of 5 on duplication, 20 out of 20 on outcomes on prior grants, 10 out of 10 on effective management, 10 out of 10 client input, 3 out of 5 org leadership, 5 out of 5 past grant administration, 5 out of 5 government partnerships, and 5 out of 5 on private partnerships, for a total of 88.
Can you address the 0 on duplication?
Yeah, let me.
If that didn't make it on the air, I was asking her to address the 0 on duplication.
They did not answer the question.
Okay. And
I apologize. The full daycare with a score of 5 had duplication, but explained it, which was the 5. This one in particular with the 0 did not answer the question.
Okay. This is a question that you would like to ask the agency, Mr. Schmidt? Or are you
No, I don't.
satisfied? Okay.
I'm satisfied with that. That's part of the process. I trust the reviewers to take a look at it. I just wanted to hear what the reasoning was behind it. But I would also like to know if it was race or gender on the organizational leadership.
It was race.
Ms. Hiller?
Not going to argue the scoring. I did notice, and staff, I don't know if you picked it up, and I didn't add it on this one, but in the budget sheet on page 6, it says city general fund, then city CDBG, and city total. There were a number of agencies that went ahead and asked for a split. Then they put the total, and then the total at the bottom included both, so it was too high. I would think the agency should have caught it, and I don't know if this is one of them. What brought my attention to this one, again, just for consideration for future, is that this shows $551,000 total revenue for the program and $525,000 in expenses. Their request to us is $11,000. There could be an argument that they don't need the money. So, in terms of how we would, in the future, consider those sorts of things.
Yeah.
Is this something that you would like to address with the agency, Ms. Hiller?
No, not at this point, and if we're gonna go with that, for our learning process in
Absolutely.
this, this glitch in the budget form, which did happen more than
Definitely.
once, I think.
It's definitely something we're going to tweak for next year.
Yeah.
Okay.
But
Thank you for your comments.
whether it's included or not in the 551, it's still more than they need.
Mhm. Any other comments, questions? Okay. Next application.
Shawnee Medical Society Project Health Access, 15 out of 15 city priorities, 10 out of 10 scope of projects, 0 out of 5 on outcomes clear, 5 out of 10 on duplication, 20 out of 20 on outcomes, 10 out of 10 effective management, 10 out of 10 client input, 3 out of 5 org leadership, 5 out of 5 past grant administration, 5 out of 5 government partnerships, and 5 out of 5 on private partnerships, for a total of 88.
Questions from the committee?
The outcome's clear, 0.
You can see on page 4, the committee did not feel that that was.
Again, it's here we have what we've been talking about consistently, agencies addressing outputs rather than outcomes. I recall that, yeah, for as an organization, one of the things that I had to learn the hard way was understanding the difference between both of them when you're writing grants. And I know that this is a difficult process. Logic models are not, excuse me, as easy as they seem. So, again, I think that this is gonna be one of those things that we were warned that we were going to see over and over again, and that we are going to have to work on training on the expectations of what we have for the future, for the organizations. Comments or questions?
Well, and on this one, again, outside just the scoring, we do now have affordable health care for everyone in America, theoretically, and signups that, with an initial deadline, this application did not reflect at all any shift in the organization's approach to helping the poor with health care. I know that one of the advantages to many of those programs is prescriptions, and one of the things is that they're negotiated low pays and co-pays, and so whether a $7.50 per prescription at this point was good in the past because it was something that nobody could get, but I've had a sinus infection all winter. I just went and got 10 days worth of antihistamine for $4 from Dillon's. Part of the negotiated health care is changing what was out there in terms of the availability of services as well as prescriptions. And so from a bigger picture to ask those questions, because the world is changing in that field, I felt was missing. And that's something I would certainly hope that they would address in the future.
Thank you for your comments.
Yeah, I don't know if you want to entertain that today, but I wanted to bring it up.
And at this point, my only concern with pulling something like this out is the fact that if we're really gonna talk about.
I wasn't asking you to, she's jumping out of her chair.
Oh. Ms. Hedquist. Could you please approach the microphone, either behind you or this one?
Our outreach office is at the Shawnee County Health Agency, and so our staff are directly referring to their patient navigators for Affordable Care Act enrollment. Unfortunately, Kansas didn't expand Medicaid, and so most of our patients make less than 100% of federal poverty level, so they are not eligible for this subsidy, and they are not eligible for Medicaid, so they remain uninsured. As far as the prescription copay, it's a $7.50 copay. If it's on the $4 list, the patient pays $4. Our funding doesn't kick in until after it's over $7.50. So anything up to that, the patient is responsible for. Anything over $7.50, then we pick up for the patient, up to $1,000 a year.
Thank you, that's good to
Thank
know.
you.
It's clearly a wonderful program that's being
Thank you.
heavily used.
Thank you for the opportunity.
Thank you. And again, this is part of whereas we may understand what the needs are changing, we also have to be aware that although we as a city have certain policies that we're trying to work by, we also have the state which is regulating
That's right.
over us. And this is one of the biggest challenges that I have heard from the medical industry, which is in our state, we do not have the extension. And without the extension, there are several people without care. And again, this is part of why all of these organizations, every organization is important for our city. Any other questions? Next.
Okay. TDC, Parent-Child Learning Center, 15 out of 15 on city priorities, 10 out of 10 scope of project, 5 out of 5 on outcomes clear, 10 out of 10 on duplication, 10 out of 20 on outcomes on prior grants, 10 out of 10 effective management, 10 out of 10 client input, 3 out of 5 org leadership, 5 out of 5 past grant administration, 3 out of 5 on government partnerships, and 5 out of 5 on private partnerships for a total 86.
Questions from the committee?
You wanna know the board makeup?
I do want to know the board makeup. You can pretty much answer that on everyone. There are
It's ju-
two
it's-
organizations that got 5s. That's the Community Action Project Attention and
Yes.
the Youth Topeka Project Jobs for Young Adults.
Yes. On this particular one, it's gender.